Scenario: the patient rang the bell. Complaining of chest pain. The patient is sitting on the chair.
The scene is safe to approach the patient. I'll enter the patient's room and I'll do hand hygiene. Hi, my name is Anne. I am one of the staff nurse here. I heard you rang the bell. How can I help you?
I am having a chest pain, nurse.
I am very sorry to hear that, but don't worry, I will help you. Let me just transfer you to your bed, and sit upright, and I'll put 2 pillows at your back.
Make sure that the patient is safe to transfer to her bed. If ever patient refuse to transfer, just tell that she will be more comfortable if she will stay in bed. If she said she feel dizzy or can't stand, don't force, just reposition her on the chair.
After repositioning, how are you now?
I still feel the pain, nurse.
We will do something with your pain, but before that, I have to do a quick assessment for me to understand what is happening to you. I will ask you questions, please bear with me.
If the patient says, "Why do you need to ask me questions? Can you just give me my medication?" Just tell that you need to do an assessment first for us to give the correct treatment and medication. Or if assessor telling you just to give the meds without asking the OPQRST, same thing, be assertive and tell that you need to do proper assessment before giving the medication for proper medicine management.
Okay, nurse.
When did the pain started and what were you doing?
Just 10 minutes ago. I am just sitting here and watching telly.
Can you describe to me the pain? Is it sharp, dull, aching, burning? Is the pain constant, intermittent or pulsating?
It's sharp pain and it's constant.
Is it radiating to other parts of your body?
Yes. It radiates to my both shoulder and arms.
Can you rate the pain from 0 mean no pain and 10 as a worst pain?
10.
Is the level of pain is the same when it started until now? Has it increased or decreased?
Pain is continuously increasing.
Let me just get a quick observation. Assessor, what's the observation of my patient?
Ask the assessor for the observation, take note of the blood pressure and do not give GTN spray if blood pressure is below 90/60.
Before checking your Cardex for any medication, can you please give me your full name and date of birth while I am checking your MRN number?
You can also ask the patient identity before transferring the patient to bed or before your OPQRST assessment, but there are assessors that they are saying since this is an acute nursing process, you need to be quick and to address the chest pain, but I believe you can do anything as long as you won't forget to identify the patient. Assessor asked before what artery was affected. It's the coronary artery.
Check the Cardex and verify with the assessor. If there is 2 assessor, as my colleague, can you please verify with me the doctor's order for patient AP date of birth the 17th of April 1992. MRN 12345 is GTN 800 microgram, sublingual, PRN 4 chest pain. Assessor, I have the GTN year, label is correct, and expiry date is 2025. Stock dose is 400 microgram, so I am going to give 2 sprays to my patient.
If the assessor is acting as a patient also, better to say, "Assessor, I'll make sure that I will verify the doctor's order with my colleague, the doctor order is." Or assumed that I already verified this with my colleague, the doctor's order is.
I am back, I have the GTN year, and this is a medication that will help to relax the muscle of your heart, widens the blood vessels and hopefully will relieve the chest pain. The possible side effects are dizziness, lightheadedness and hypotension. It is very important not to get out of your bed, to prevent any accident or fall.
You can provide bedside commode if they want to use the toilet.
Do you have any allergy with this medication? I will do a test spray before giving it to you, and also do not swallow the medication or drink anything after administration, and I am going to spray it under your tongue.
Ask the patient to open their mouth and curl their tongue, then give the spray under the tongue and reassess after 5 minutes. If the assessor asks why under the tongue, superficial blood vessels is abundant under the tongue for rapid absorption of medication.
Hi Air, how is it now?
Much better, but I still feel the pain.
Can you rate it from 0 to 10 again?
Now it's 8.
Okay, let me check your observation again. Assessor, what's the observation of my patient? I am going to give you the second dose and will wait for another 5 minutes. Hi Air, how is it now?
I am much better now. Pain score is only 3.
Do you need another dose?
No, nurse. The pain is tolerable.
That's good to hear. Now I want to discuss what happened to you a while ago. You experienced angina or chest pain. This is
And give health teaching.
If you feel chest pain again, do not hesitate to use the GTN spray. You can use it until 3 doses with 5 minutes interval. If unrelieved, at third dose call 999 or 112 and unlock your door. Before using the spray, check the expiry and do test spray away from your face if you haven't used it for 5 days. Do not swallow or inhale the spray. If you got out of home, make sure to bring 2 extra bottles with you, and you can wear an emergency alert bracelet so people would know that you have this condition. If you feel chest pain in a public or crowded place, try to go to a safe place, sit down, may feel lightheaded, relax, and use your GTN spray. If your mouth is dry, take a sip of water.
Then the assessor will give you a small piece of paper to write your documentation. Documentation guide. Date and time it happened. Patient rang the bell and complaining of chest pain. Reposition patient. OPQRST assessed pain score of 10 reduced to 3 after 2 doses of GTN 800 microgram. Given at 5 minutes interval, blood pressure checked before each administration. Health teaching done, referred to doctor or medical team, then write your name, RGN title, then date and time.
Don't forget to like and subscribe.